Jill Marlin is the CEO and founder of Peak Performance. Jill, Mid-Michigan has been hit really hard with COVID. Luckily, many people have recovered, but how can physical therapy help with complications from COVID?
Right, Deb. Thanks so much for having me today. Absolutely. Back in March, we were hit extremely hard, and then again in November. And fortunately, many people have recovered from COVID. And from a physical therapy standpoint, a lot of people are starting to realize as they're starting to get back into sport or just daily functional living that they're having to have some residual challenges. And so with lung capacity and functional level and fatigue. And so physical therapy can help drastically with these changes, whether it's pulmonary or lung rehab, whether it's deconditioning, we can do strengthening exercises. We can do all of these things to help really get you back into the pre-COVID form that you were.
Yeah, I've heard that from some of my friends who are just struggling with energy and with getting enough breath, and I hadn't realized that physical therapy was something that would be useful. Now, does somebody have to have symptoms to reap the benefits of PT?
One of the biggest myths is that you have to be sick or injured to get better across the board. And so I truly feel that you don't have to be symptomatic. Some of the best, whether you're looking at a professional athlete or a mother that's staying home that's taking care of the household, any of these people, the high peak performers of our society, realize, and they truly get this, that you don't have to be sick or injured to get better. So, really reach out to one of our practices, and we're happy to help, and we can realize some of the deficits that you may not even know that can really make you better overall in your functional independence.
Our bodies are truly where we live every day, right? We're carrying this around every day, and sometimes we just live with chronic pain, and that pain can often be addressed by physical therapy. You don't have to live with it. There are ways to work around it, and you and your staff are certainly going to help people find that. You don't always need a doctor's referral to get an appointment to see a physical therapist, do you?
You don't. There's two different ways that you can get in to see a physical therapist, and one of them is direct access. So Michigan is one of the states that you do not need a prescription. Most insurances do not need or require a prescription for the initial evaluation for physical therapy. So you can walk in as you would your doctor or any other professional massage therapist to physical therapy and schedule an appointment. Also, if you do have an insurance that does require a prescription, talk to your physician, ask them for a prescription for physical therapy that just says evaluate and treat, and you can walk into any of our 4 locations and receive care.
Jill Marlin, CEO and founder of Peak Performance, thank you so much for sharing that information with us today. Take care.
Thank you.